Together we achieve victory over heart failure.
Hello and good evening to all, and welcome to the podcast. I am Dr. Shyam Lakshman, presently working as assistant professor in cardiology in Government Medical College, Kannur. And today we are going to we are going to see a silent epidemic that India is combating, which is known as the heart failure. In India, the majority of the patients gripping with heart failure are surprisingly young individuals, and it is very common to witness young individuals or young adults seeking medical assistance for heart failure, unlike in Western countries where heart failure is a disease of the elderly. So, coming to heart failure, it will be better if we break down it into five essential insights. First, what does it mean when a doctor says to you that you have heart failure? When a doctor diagnoses you with heart failure, or when people get diagnosed with heart failure, they think that it's the end of their lives. The term heart failure can be frightening, but it simply means that your heart is struggling to pump blood as efficiently as previously it used to be. The ejection fraction, or EF, it measures how good your heart pumps blood. It is the amount of blood that is pumped out of your heart into the lower chambers and subsequently when it contracts. The normal EF is around 50 to 70 or up to 72, or individuals with heart failure usually have an EF of less than 30% or lower. Secondly, why are so many Indians affected with heart failure? Genetics play a very significant. Indians are genetically more vulnerable to cardiovascular diseases and more commonly hypertension, diabetes, obesity, and smoking. All this worsens the epidemic. Moving on, what are the signs and symptoms of heart failure? Watch out for confusion, fatigability, heart palpitations, nausea, shortness of breath, and weakness. Also, some uncommon symptoms might be there might be loss of appetite or vomiting. Lastly, how can we protect ourselves from this disease? Our heart needs to be working to keep us alive. Most important is early detection of heart failure through regular blood tests, dietary adjustments to maintain the heart health, and incorporating daily exercise, practicing stress management, quitting addictions like alcohol, tobacco, or smoking. What comes next after the heart failure diagnosis? Thankfully, medical science has been very advanced nowadays, and there are numerous treatment options. And all this are helpful to lead an enjoyable, meaningful, and productive life. Heart failure medications, what it does is improves the quality of life and it improves the longevity. Devices like biventricular pacemaker, ICDs, or implantable cardioverter defibrillator, and heart valve or surgical treatments are other modalities. And the last option, if it is not amenable for medical or surgical treatment, is heart transplant. The lifetime risk for heart failure is 1 in 5, both men and women. Remember, awareness and proactive measures are very key in combating this epidemic. Thank you and wish you all a very happy